Hello, everyone, and very, very excited to be here. There's actually never been a more exciting time to watch the transformation of healthcare. Healthcare is evolving, and the challenges are real as we all are experiencing them. I'm Ruthy. I'm the director for the health industry sector across Central and Eastern Europe at Microsoft. And I'm really delighted to have the opportunity today to talk to you about transformation in healthcare, and specifically how AI drives that transformation in healthcare, where honestly we all strive to create really better insights, better experiences, and ultimately better care for patients. I want to talk a little bit about the trends in healthcare. What we're seeing is that, first of all, there is what we call the consumerization of healthcare. Patients want healthcare organizations and institutes to have full access to their medical history. They want this 360-degree view. And honestly, care teams also want this 360-degree view. Data, a gold mine. There's 4 trillion gigabytes of data generated annually in healthcare, and that doubles every 2 years. With that comes AI, because when you have data, you want to analyze that data. You want to extract insights out of that data. So 6.6 billion is the expected value of the AI in healthcare market by 2021. And as the healthcare industry strives forward towards innovation, we also have to remember that healthcare is always grounded in compliance and regulation and security. 6.2 billion was lost per year to data breaches. We see ransomware and attacks in healthcare. So we really always have to make sure that any system that we have, no matter what it is always grounded in end-to-end security and privacy. With these ongoing trends in healthcare that we've been seeing over the past few years, we also see a really rapid transformation due to COVID. So what did COVID create? What is the disruption that came due to COVID? Well, 70% of elective procedures were canceled. Just to give you an example, 200,000 cancer screenings were paused each week in Great Britain's NHS. You understand the impact of that for healthcare, for the health of patients, for early detection, for later care. That's huge. The other thing that COVID created is a really big need for collaboration, whether it's collaboration across systems, across organizations. A lot of hospitals need to transfer information between them, and healthcare organizations need to transfer information, and also towards more and more partnerships and even mergers and acquisitions. And what we see is that healthcare leaders move from managing the crisis. They seem to know, okay, we know how to manage this crisis now, towards, okay, how do we reinvent the successful future of healthcare? So what we're seeing is a new vision for healthcare. We see that we want to gain that holistic view of the patient. We want insights. We want actionable next steps. We want to be more informed as a patient, as a care provider. We want personalized care. We want to increase the number of patients that are served. So a lot of the time that care teams spend is actually on administrative and updating systems and updating each other. If we could reduce that time and spend more time with patients, that means we're increasing the number of patients served and still keeping high quality and high touch interactions. We want to visualize health trends, right? A picture is worth 1,000 words. We want really to see our health trends, our outcomes. We want to be able to see what would mean better care, and even, for an organization, what does it mean to have better resource planning? We want to serve communities. This has been really, really seen in COVID. We want to reach every single person in the community out there. We want to make sure that the outreach to the community is coordinated. And we want to make sure that those who really need the care the most get it. We want to be able to scale, right? So now we need to scale with every wave. We need to scale, then we need to scale up and then down. We want to make sure that we have a platform that we can leverage, that we can scale with, that can grow as we innovate. And finally, we really want to improve that experience, both for the patient and for the care team, so that really we have that easy and quick access to health information. What we're seeing is that organizations are actually investing in technology in order to make that vision happen. So They want that 360-degree view, right? To lower operating costs or to get better data organization. So they're putting all their data together in a common data estate or in a common computing platform. They want to be agile. Organizations want to be agile. Hospitals want to be agile. Doctors, care teams, governments, ministries of health, they want to be agile. They want to be able to respond quickly. So they introduce modern applications. They introduce what we call low-code capabilities. Jean-Philippe mentioned that in his speech earlier today. That means that you don't need to be a developer in order to customize your app. You can have what we call a low-code, no-code capability, so anybody can actually customize an app, a modern application to their needs. And finally, we really want to transform research and care to really dramatically enhance population health and health outcomes. And that's where artificial intelligence comes in. That's where customer insights come in. And that's where personal engagement come in. So let's talk about that gold mine of data. There is what I call the health data surge. Healthcare organizations have inputs coming from everywhere and anywhere. There are so many sources of data. There's that 4 trillion gigabytes of healthcare data generated annually. Where is that coming from? Patient inputs, clinical data, population health, so that we understand the broader trends affecting patient populations. Operational data, how to manage our facilities, how many ventilating machines do we need, how many vaccinations do we need and when, so in order to give really efficient care. And then add to that what we call IoMT, Internet of Medical Things, device and sensor data that is coming from home care or from watches or from any device that patients carry on them. So this Internet of Medical Things adds another layer of data that healthcare organizations need to work with. So actually what we see is 90% of the data in healthcare is actually unstructured, and I would even say almost inaccessible in order to really drive data-driven decisions. You know that 70% of the time spent on working with data is actually spent on ingesting it and unifying it. So the challenge isn't lack of data, it's lack of interoperability and integration across data systems. And that's what we want to solve. So I think we all understand that data is becoming increasingly effective in healthcare. And there are countless examples of how data can give healthcare delivery that holistic view of the patients, a patient needs, and to improve outcomes and to reduce costs. But it's not only the patient data that we need. I mean, I want to give you an example just to explain to you. A healthcare organization is looking into patients to see who is sacrificing medication adherence in order to buy groceries. Knowing that about a person can lead to very simple intervention and can lead to an action that could lead that person to get the better care that they need and eventually to better health. It means better health for the patient, and it means more effective health for the healthcare organization. And it's not about just understanding the patient. It's also about understanding doctors, nurses, administrators, and everyone on the front line of healthcare who are incredibly burdened today by the mountains of administrative tasks, as we said them. And data can help power that automation of tools that can reduce this burden. And finally, we really think data is the fuel for a new generation of precision medicine, where we all strive to be. So when COVID started, we were approached by many organizations who said, we need you to help us, respond and recover from this situation now. We need technologies that will help us deal with our situations and our challenges now. And really, we want to rethink how we reimagine our future. This has been said a few times today, that 2 years of transformation actually happened in 2 months. And this is just growing. So how can we help organizations respond, recover, and reimagine future? What we've seen, first of all, is that transformation is a journey. You have to have, as an organization, what is the vision? What is your vision and strategy for your transformation? What is the culture? You want to make sure that there's a culture that enables that transformation, that's inclusive, that's diverse, that is open to change and learning and skilling. you want to make sure that it's clear what your unique value proposition is, right? What the unique potential is. I come from the startups background, from the startups world, and I always tell startups, what is your unique value proposition? Why would a customer choose you? Why would a patient choose you? Why would a doctor choose that healthcare organization? That is really important when you do transformation. And finally, capabilities. What are those capabilities, the resources, the skills that you need in order to have transformation and to make that transformation happen? So putting it simply, technology is the tool. People are the focus in healthcare, and more value is the outcome. What we've seen at Microsoft is that the more we can let technology accelerate transformation and help healthcare organizations transform fast and deliver and be agile, as we said, the better the more successful they are, the more we empower them. And we've realized that there's a few key scenarios that repeat within the healthcare organizations, like enhancing patient engagement, like introducing a health bot as COVID started, which takes 4 hours, but reduces the volume on a call center by 50%, just because so many of the questions that related to COVID repeat themselves. And then that bot identifies when there's a question where a care person needs to go and speak to them. Or, excuse me, empowering health teams and professionals. How can we make that collaboration between care teams more streamlined? How can we ensure that they can exchange information over a secure platform? And then improving clinical and operational insights. How can you really leverage and harness data to make sure that, excuse me, that we are extracting insights and actions out of the data? So whether it's, empowering health teams by introducing a speech recognition module that listens to what the doctor says and immediately puts that in the health record and saves them a lot of administrative time, or using data and insights to track all the equipment and all the procedures that are happening in a healthcare organization, and then planning and predicting next year's budget according to that in a precise way. And then finally, accelerating scientific innovation. How can we harness, technology to really leverage the power of the data, the size, and extract insights? And we don't do this together. We are true believers in partnerships. We don't think, anybody can win alone. And we're partnering with over 168,000 organizations in 140 countries in order to really harness the data, the collective data, the collective knowledge in order to make transformation happen. I want to give 2 really quick examples. For example, the JAX Institute, which is called the Jackson Laboratory, which is a biomedical research institute, which put all the cancer genetic research together in one place into a searchable database. But guess what? There's 4,000 papers published a day. How can you extract insights from that? How can you really find the one you need for your research or for your patients? So what they did, they introduced AI technology that enables the machines to read complex medical and research documents and highlight the important information they contain. Or take Novartis. This is a strategic partnership that we launched with Novartis. And the idea here is, how do we collaborate with Novartis as a pharmaceutical company to really leverage AI? And we introduced actually AI in every single stage of a drug development process: research, clinical trials, manufacturing, operations, and finance, so that we empower the researchers and all the people who work on this drug along the way, and we really accelerate the speed the drug is developed. And we all know how important that is these days. So healthcare is transforming. And what we see is that we want to make sure that the information we need to live longer and better lives is always at hand, and that getting the care that we need is simple and a curated experience where, picking up a prescription is just as easy as going for surgery. And the providers will have the tools to deliver personalized care, and that drug development is faster, and that everything we think about health and disease will change. So I want you to think of a few questions after this session, like, what does successful healthcare look like for you? And what are the challenges that you have as a healthcare organization? And how can AI help you transform now? I want to introduce a very interesting research that we launched in Seattle about sudden infant death syndrome and how we leveraged AI to really understand what causes this syndrome and really accelerated the research for this syndrome. Let's play this video.
Every year, over 3,500 infants die of SIDS-related causes in the US alone. My son Aaron was one of them. The Microsoft data science team took publicly available CDC data of 26 million births and deaths and ran Microsoft AI on it. They discovered new correlations that showed statistical increases in SIDS. And then we went to Seattle Children's with their world-class medical researchers.
Our goal is to recognize SIDS early and prevent it from happening. The data told us there are clues that are definitely worth pursuing.
You have to bring everything together on the molecular level, genetic level, and big data level that give us hope.
We've been working together to create a genomic database that will identify many new genetic risk factors and new genes and pathways that can underlie SIDS.
Through his DNA, my son Aaron is the first child in this database.
We can very efficiently perform genome sequencing. The challenge is often interpreting it. Microsoft AI is extremely instrumental. We can analyze the data in a massive scale and look at signals that emerge.
Now we have a million more hypotheses that we haven't even thought of.
This database allows us to share our results and collaborate with our peers anywhere in the world.
SIDS is the unknown. That's what makes this so challenging. The genomics database is empowering researchers on all new avenues of research.
Our efforts will transform research for generations to come. I do believe we'll find answers.
You know, this research was actually one of the bases for our AI for Health initiative across Microsoft. So I want to leave you with one important thought. There's a major revolution in healthcare happening now, and it's driven by artificial intelligence. So if you could answer for yourself, how will you revolutionize healthcare? Thank you very much.
I have just one question. How are you partnering with the healthcare organization, and how the Microsoft helps with that?
It's a very good question. Like I said, we're big believers in partnering, and the way we partner is really we go and we talk to the people in the organization, whether it's the researchers or the doctors or the care teams or the nurses or the administrators, and we ask them about their pain. And we ask them why. What is their pain? What do they need? What are their challenges? And then we think together with them, how can we empower you? You know, Microsoft's mission is to empower every person, every organization in the planet to achieve more. We really act by this on everything we do, whether it's internal or external. So we really go and work with the people in these healthcare organizations and understand their challenges and bring all whatever resources we can from within Microsoft, whether it's researchers, whether it's technology, whether it's platforms, programs, partners, anything we can to help empower them.